Hi, Dr. Yass here. I feel unbelievably compelled to have to discuss a particular case that I just ran into so people can wrap their heads around how insane the medical system has become in providing diagnoses that clearly make absolutely no sense. There is no question that the lunatics are running the asylum when it comes to trying to get the right diagnosis so that you can have your pain resolved. People have to understand that if you don't get the right diagnosis, which is to say the tissue in distress eliciting your symptoms, you will never see your pain resolved. You will never return to a normal level of of function. Your life will be forever altered to the negative for the simple fact that you are not identifying what tissue is creating your symptoms, which then allows the proper intervention, treatment to be utilized to resolve the distress of that tissue. So I need everyone to understand this concept. I get contacted by a guy who is being told that he needs a knee replacement because he is bone on bone. He has had this pain, this issue that he's been describing, a grinding, a pain at his knee joint for years. It is now affecting his ability to do simple things like he can't squat down if he wanted to go down and pick something off the floor. He can't even get his butt to knee level, let alone to be able to sit on his heels because of this pain he has in his knee and this grinding that he feels. He can walk upstairs pretty well, but he cannot weight bear on his leg when he's walking downstairs. Those are his two primary complaints. And of course, he was a runner, and that's just become out of the question. He can't run. Okay? So his symptoms are pain and grinding at the knee, and it limits his ability to run, which is his passion, to go downstairs and to kneel down so that he could reach something on the floor by basically putting his butt on his heels as he kneels down. Okay, that's the symptoms. He goes to 3 orthopedic surgeons. They take x-rays, and all 3 confirm that he is bone on bone, requiring a knee replacement. So he did his due diligence. He tried to get multiple opinions, and every one of these people tell him he's bone on bone. Now, let me first give you the theoretical understanding of what bone on bone means. Then we'll go on and we'll present why it is literally lunacy to give this diagnosis based on the presentation of this guy's symptoms. Number one, they got the diagnosis based on looking at an x-ray, which is nothing more than an image, and they're establishing whether there is 0 joint space, which is what bone on bone represents, by visually interpreting an image. There is no attempt to look at the physical presentation of this guy's knee. They simply, all 3 of them, take a picture, look at it, and say you're bone on bone. So we start with the most obvious question. What if there was a 32nd of an inch or any small aspect of joint space remaining? Could the human eye differentiate that level by looking at an image? The answer is obviously no. So you go to someone who does surgery for a living and you ask them by human eye to interpret an image, which is physically impossible, and you are shocked by the fact that that individual tells you you're bone on bone. I describe that as a self-fulfilling prophecy. That's how I describe it. So we have to accept, you all have to start wrapping your head around the idea that interpreting an image cannot define whether you're bone on bone. Straight out, no question, irrefutable. Right? Now, let's talk about this concept. He goes on to tell me that he was in the doctor's office in all 3 cases, and he says, look, doc, I can lift my knee up and I can straighten and bend my knee with no pain, no grinding whatsoever. I have full range of motion and I am pain-free when I move my knee, when I have my foot off the floor and I'm bending and straightening my knee. It's only when I'm weight bearing that I have the problem. Now, let's go to the idea of what bone on bone means. Bone on bone implies that there's no more joint space, that literally the femur is sitting directly on the tibia. The thigh bone is sitting directly on the lower leg bone. There is no more space. Well, you would have to know that there's a reason why there's a space in every person on the planet's movable joints, which that space is held by a meniscus or a labrum, and that is because the joint surfaces don't stay in perfect location. They actually glide. As the person's going through motion, those joint surfaces have to glide on one another, and you need a space for that gliding to occur. If you're bone on bone, and this is just defined, I'm not making this up, this is what it means. If you're bone on bone, it means there's no more joint space. That's what the phrase means. If there's no more joint space, you can't have glide. If you don't have glide, you can't have range of motion. So the physical presentation of being bone on bone must be that there is a major loss of range of motion. And at that endpoint, if you try to push it further, it feels like a bone is hitting another bone. Now, let's put this in context. Over 28 years of treating people, thousands of people coming to me with a diagnosis of being bone on bone, scheduled for joint replacement, I have found 2 people that presented with that presentation as I just described it. Major loss of range of motion, end range feels like a bone hitting another bone. The thousands of others I've treated presented with full range of motion, indicating what? There is joint space. There must be joint space, and therefore they can move their joint through full range of motion. So they can't be bone on bone. It turned out they had muscular deficits, resolved that, and they ended up being pain-free, never getting surgery. So let's go to this guy's case. He straight out told me he showed these 3 guys that he brought his knee up and he was able to straighten and bend his knee, full range of motion, no pain, no grinding, no nothing. Clearly, he showed them he had range of motion. He couldn't possibly be bone on bone. And yet, they're willing to say he's bone on bone. It's illogical. This is lunacy. The dude presents, shows these guys that he has full range of motion, and they still stick with the concept that he's bone on bone. Going against the principles of what the words bone on bone mean. You must understand, this is cuckoo. This is nutso. And so it just turns out, through the grace of God, that someone these people knew happened to know who I was, and I evaluated him and was able to show again in the evaluation through a Yass method Zoom session. I'm in Jacksonville, Florida, there in California. I was able to show clearly he has full range of motion, no questions asked, so he can't be bone on bone. By the way, his pain was around his kneecap. If you were bone on bone between the thigh bone and lower leg bone, that would create pain where? Between the thigh bone and lower leg bone, at a place called the joint line. The kneecap attaches into the knee joint at a joint between the kneecap and the thigh bone, which is actually a completely independent joint. Independent of the joint between the thigh bone and lower leg bone. So bone on bone couldn't even create pain around the kneecap. That's another point of showing how psychotic this premise is. The dude is having pain at a place where it shouldn't be if bone on bone were to create pain. Think of the lunacy of that. So after doing some follow-up testing, checking his flexibility, strength testing, how he moves, postural variations, it was quite evident that the guy's primary problem is, especially for the fact that this dude was an average jogger, that he had developed such an imbalance between his quads, his front thigh muscles, and his back thigh muscles, his hamstrings, his quads had shortened severely, severely. And as a result, because it's attached to the kneecap, it is creating an excessive upward force on the kneecap, causing the kneecap to be compressed. So when he goes to bend his knee, like when he's walking, jogging, or kneeling down, the compression is so great that it creates a horrible level of pain, and there's misalignment, so the joint surfaces are rubbing, creating that sound that he's experiencing, and the tautness limits the ability of the mechanism to allow the flexibility to exist for it to kneel down. So we did 3 exercises. Hip abduction, exercise to strengthen the gluteus medius, which is a muscle that sits on the side of the pelvis, allows for normal balance and stability. Strengthen his hamstrings, the posterior thigh muscle, to lengthen out the quad. Strengthen the gluteus maximus, to lengthen out the hip flexors, also in the front, as well as a part of the quad. 3 sets of exercises of those 3 sets of each one of those 3 exercises. And when he was done, it was almost shocking. He could almost put his butt all the way down on his heels. He could almost have full range of motion. One bout of 3 exercises, 3 sets of 10 repetitions with the right resistance. You got to understand this. I said, go try to walk down the stairs. He goes to tries to walk down the stairs. He's like, it's substantially better, substantially less pain. 1 bout of exercise. I don't know how to explain this any clearer, and I will continue to put these videos out so that some lucky person who happens to come upon the video will recognize they should never get surgery based on an X-ray or MRI finding to supposedly justify that they're bone on bone, and that in fact there must be a physical presentation, and the symptoms being experienced must be the symptoms that would exist if the structural variation identified that you're being told is the cause of your pain would create. You got to understand, this is never going to, by the way, if that surgery got performed and the guy still had his horrible knee pain, which he would have, I can tell you that now, even before he had the surgery, because whatever they were saying was the cause of the surgery was the cause of the pain, wasn't the cause of the pain. So surgery of something that's not causing pain isn't going to fix the cause of pain. I mean, this is pretty obvious stuff, right? He was still going to have the pain. Guess what? Those guys, whoever was the fortunate one of the 3 that got to do the surgery, they were going to get paid, even with them having the same, if not greater pain. That's called fee for service. That's the way the global system works. So if you want to know why the system continues, even with the overriding extensive evidence that all this nonsense isn't working, if I got paid and I didn't have to worry whether there was a positive outcome to what I did, I'd keep doing what I was doing too. So it's up to you. It's up to you. You're going to have to decide. Most of you are scared shitless about getting these surgeries for good cause. You know your family members, your co-workers, your friends, all of them have seen the failures, and you're scared that it's going to be you too. Well, stay out there, keep searching, keep Googling, or DuckDuckGoing, whichever, and hopefully you'll come across this video and it'll make sense to you. You'll recognize, I'm probably just like that guy, and it's probably a muscular cause. 98% of cases it is. 28 years, thousands of people, I will tell you in more than 98% of cases the cause of pain is muscular, and 95 to 98% of these surgeries being performed are baseless and do not work. That is why you have chronic pain at an epidemic level, 130 million Americans, 1 billion people worldwide. Please take it upon yourself. Search out the Yass method. Let's get you out of pain. Let's get the right diagnosis and the right treatment, and let's get you back to living your life once and for all, so you don't have to stay in this cycle of insanity any longer. you want to get in touch with me, you can contact me by email at drmitch@mitchellyass.com. Description, it'll be in the description below. If you want to contact me or see my website, livewithoutpains, plural.com, livewithoutpains.com, or you would like to schedule a Yass Method Zoom session so that we can properly diagnose and treat you, you can do that as well. Description will be, the spelling of the website will be in the description. If you like this video, please give it a thumbs up. If you would like to subscribe to my YouTube channel, Dr. Mitchell Yass, please do so. You'll then get notifications when new videos are added or when I'm live on YouTube. Please, let's work together. You're coming up on the new year. Why not start the new year right by getting the right diagnosis? You must understand that this diagnostic testing model fails because it is baseless. More than 95% of you are being misdiagnosed. And just because you get that diagnosis and all subsequent treatments fail doesn't mean you just haven't found the right treatment. At some point, you're going to have to recognize it's because you got the right diagnosis. Remember, these muscular causes, 4 mechanisms of muscular causes creating symptoms, accounts for 98% of cases of pain, and these do not show up on diagnostic tests, and there is no medical practitioner educated or trained to identify them. If you start recognizing this, it'll start making sense to you. All right? For now, this is Dr. Mitchell Yass wishing you a pain-free, fully functional life. Bye-bye for now.